Thank you for the opportunity to speak today and for all of the great presentations. I think this talk follows nicely from all the other talks. Today I'm going to be speaking about the epidemiology of endometriosis in UK adolescents, and I'm an epidemiologist, not a clinician. In terms of my disclosures, I'm an employee of Merck Sharp & Dohme. I'm also presenting today on behalf of my co-authors listed here. So I think we've had a lot of background on endometriosis. I won't spend a long time going through this. I think the main point here is, as others have mentioned, is there's a variety of ways that endometriosis can eventually end up being diagnosed. There is documented in the literature that there can be a substantial delay in diagnosis, especially in younger age groups. And so what I've focused on in this presentation is trying to understand how often we're seeing diagnosis in an adolescent age group in the UK. So to begin with, we did take a look in the published literature to try to understand in population-based studies, so not in patients presenting for surgery, but kind of in larger, more representative samples, what estimates were already available for adolescents in the published literature. So we did find a number of studies, and a lot of the studies had a younger age group included. None of the studies actually looked at patients from around 12, so postmenarchal women, until age 17, which was really our interest in the study. And you can see here that the estimates that are provided vary quite a bit. This is mainly due to the fact that there's different definitions for endometriosis and different practice patterns across the different studies included here, so they're not directly comparable. But this is just a summary of what we did find when we looked in the literature. So for this study, we were aiming really to understand the prevalence and incidence of endometriosis in an adolescent sample. We did actually initially aim to look at those who were 10 to 17 years of age. In the database that we had and were using for the study, we didn't have information on whether or not an individual was postmenarchal, and so we were trying to be very inclusive and capture all cases possible. But when we did start the study, we didn't actually see really very many cases at all in 10 to 14-year-olds, so we weren't able to provide estimates for that age group. And so we really focused then on 15 to 17-year-olds. Our study period was from 2006 to 2016, and our primary objective was to look for adolescents who had some type of evidence of surgical confirmation. Secondary objective was to look for kind of a broader definition of endometriosis, where we were just looking for evidence of a clinical diagnosis and didn't require evidence that any type of surgery had been performed. And then in an exploratory objective, we looked to understand the use of endometriosis medications in these adolescents. In terms of our approach, we use the Clinical Practice Research Data Link, or the CPRD database. This is an electronic GP-based healthcare database that contains longitudinal primary care records that cover about 7% of the UK population. This database is used quite often in epidemiological investigations. In terms of the way we identified the endometriosis cases, we were able to find a publication by Soriano et al. That used a similar database in the UK called the THIN database. And they were able to validate a code-based definition, so clinical codes were used to identify the patients. They used codes called read codes, which is a coding system that's specific to CPRD, and they were able to use, CPRD and THIN, they were able to use free text comments within the THIN data as well as physician questionnaires to validate the cases of endometriosis that they found, and they found a positive predictive value of 94% for their read codes. So we used that same list of codes in our study. As I mentioned, our primary objective was to understand surgically confirmed endometriosis. And with the CPRD data, you can also link this database to hospital data. And so we did do this for the primary objective. We looked within the CPRD, but also within the hospital data for patients to try to understand if there was any type of surgical coding there that we could use to look for evidence of surgery. And then, as I mentioned before, in our secondary objective, we just looked for any type of read code or clinical diagnosis. In terms of incident cases, as you might expect, these are cases with no recorded diagnoses of endometriosis in their medical record before the start of our study period. We also required that the practices that were included in our study had up to standard data according to CPRD's research guidelines. And then in terms of prevalent cases, these were cases that could have had a diagnosis before the study period, so there's existing cases of endometriosis, or could have been diagnosed during the study period. We looked at an average annual prevalence of endometriosis. So to orient you to the slide, actually not sure how to use that. So if the data point that's the furthest over on the left with the blue circle, just to ignore that one for a moment. If you look at the two other incidence estimates in the 15 to 17-year-old age range, these are for the primary and secondary objective in the study. So in terms of clinically diagnosed endometriosis in 15 to 17-year-olds, we saw an incidence rate of 13.6 per 100,000 women years, and surgical diagnosis of 8.1 per 100,000 women years. And then the estimate furthest over to the left with the asterisks in 12 to 19-year-olds, we generated this in our study population so that we could compare to the estimate from Soriano et al. Because we were using the same code list and we wanted to understand how that would look across the two data sets. And so we did see in 12 to 19-year-olds, Soriano et al. Had a rate of 19 per 100,000 women years, and in our study we had an estimate of 18 per 100,000 women years with a confidence interval that included the estimate from Soriano et al. In terms of prevalence, these prevalence estimates are per 100 women. And again, it's the same organization of the data on the slide. So furthest to the left is our estimate to compare to Soriano et al. The middle estimate for prevalence is clinically diagnosed, and then furthest to the right is the surgical diagnosis. So the average annual prevalence over our study period of clinically diagnosed endometriosis was 0.026, and surgically diagnosed was 0.014 per 100. And then again, we saw good concordance with what Soriano et al. Reported. They had an estimate of 0.05 per 100 in the 12 to 19-year-olds versus 0.04 in our study with a confidence interval that included their estimate. And then for our exploratory objective, we just wanted to understand sort of descriptively over our study period what the use of medication that might be for endometriosis looked like in the prevalent cases that we identified. So you can see on the left side of the graph, this is the use of hormonal medications and pain medications in clinically diagnosed cases. And on the right side, you have the surgically confirmed cases, and again, the use of hormonal and pain medications. And you can see the majority of these 15 to 17-year-old patients with clinically and surgically diagnosed endometriosis had prescriptions for pain medication and hormonal medications over the study period. So then, in conclusion, we found the incidence and prevalence of endometriosis to be quite low in 15 to 17-year-olds. This is really what we would expect. This is a diagnosed incidence and prevalence, so there may be quite a lot of disease that's just being delayed later, as there is a documented delay in the literature of around 7 to 12 years on average for women when they initially, from the time they initially present to actually receive their endometriosis diagnosis. From the population-based studies that we found in the literature, the estimates of incidence and prevalence in adults were quite a bit higher than in adolescents. So we found rates of incidence from 65 to 350 per 100,000 in adults, and prevalence estimates ranging from 0.81 to 5. So again, much higher in adults than adolescents, as would be expected. I think I already touched on most of these. Also, just to mention that there are very few previous studies have actually examined incidence and prevalence in population-based samples of adolescents, so not select samples who are reporting to a clinic for surgeries or other procedures. And our estimates in our study were quite similar to those reported for Soriano et al. In their study. So there are some limitations to this study. One really to mention that I already sort of called out is that endometriosis is a symptomatic condition. So what we're capturing here is endometriosis that really came to the attention of clinicians and was diagnosed, but doesn't represent the true underlying burden of endometriosis. So in conclusion, endometriosis was infrequently diagnosed clinically and surgically in this population-based sample of adolescents. So again, we did look in the 10 to 17-year-olds, but we really didn't see any cases from 10 to 14. So it tended, when it was diagnosed, it tended to be diagnosed mainly in those who were 15 years or older. And in accordance with clinical guidelines, there was limited surgical confirmation of endometriosis in this adolescent population.